Salam. It's a pleasure to be here, and I've been asked to talk about AI in healthcare. First, some conflicts of interest. In terms of disclosures, I have received honoraria for speaking in one-time advisory boards from Takeda and Baxter, and I'm an advisor for Signal One and Mutual Health with their two health AI startups, and I've received research funding from Roche. I want to start off by some objectives. Objectives are very simple. First, I want to articulate basic definitions of AI, machine learning, and deep learning. Second is to identify key opportunities and challenges of applying AI to healthcare. And the third is to recognize implications of AI to the future of healthcare. I'm going to start off by asking everyone, how many people are very comfortable with AI? Getting there. Okay. How many people think AI stands for absolutely incredible? Okay. All right. So there's a bit of a mix in the audience. Okay, I'm going to start off with some basic definitions. AI, very basically defined, this is a very common definition, is any technique that enables machines to mimic human behavior. Right. Oh, it's not here. Got it. Okay. There we go. Okay. So AI is defined as any technique that enables machines to mimic human behavior. So if you think about it in basic terms, a calculator really is AI, right? Because it's enabling a machine to mimic what we would do. But I would say it does it much faster and it does it much more accurately than we do. I'm going to expand on this in a bit if people are interested, but I'm going to leave that till a little bit later. What's machine learning? How many people have taken courses in statistics? Okay, how many people hated their courses in statistics? Yeah, okay. So I'm going to give you some trauma. I'm going to take you back to your statistics courses. If you remember building regression models, how do you build a regression model? You would have a lot of control over it, right? So you'd be able to define the dependent variable, the independent variables. You'd be able to build in correlations between the variables, build in interaction terms. You would have a lot of control over these models in terms of how they're built. In machine learning, basically the computer says, just give me the data. Don't worry about it. Go have a coffee. I'll figure it out and I'll call you back when I'm done. So machines have much more control over the analytics around that data and understanding complex relationships. So what's deep learning? Deep learning is basically machine learning, but with more data and more complexity. That's all deep learning is. Now, why is this scary? How many people have not heard of ChatGPT? Please, nobody raise your hand. Okay, everybody's heard of ChatGPT. There's DeepSeek. There's lots of these large language models. How many people are really impressed by what ChatGPT can do? How many people are not impressed at all and think it's just garbage? Okay, so there's a couple of people out there. Your mileage may vary. What a lot of people haven't really understood properly yet is prompt engineering. So what is prompt engineering? Basically, it's the way you ask it questions. The more detailed you are, the more sophisticated you are in how you interact with ChatGPT, the more impressive it becomes. So many people don't really know how to ask it questions, and the results they get are really not very good. But it has a lot of power and potential. Oh, sorry. I'm going to talk a little bit about the application of it in healthcare. So this belongs to a field called generative AI. Basically, generative AI means the computer is going to use existing information to create new information. So ChatGPT is going to use all the stuff on the web and textbooks and whatever have you, and then it will generate an answer for you. That's why it's called generative AI. Now, there's a lot of work being done in medicine in generative AI, and some people will say it's nonsense. Other people will say I'm scared. How many people are scared of the potential of this sort of stuff in AI? Yeah, I think some of us should be, actually, because you'll see headlines like this in the New York Times. AI chatbots defeated doctors at diagnosing illness. How many people think that's true? Okay, how many people think that's absolutely not true? It'll never defeat us. All right, wonderful. So we have some disagreement. So there was a study that was published, and this is why this article was written. It was published, actually, I'm going to go back up a bit. It was published in JAMA Network Open. Basically, what researchers did was they did something really interesting. They basically did a small randomized study, and they said, I'm going to randomize a bunch of doctors to conventional best evidence. All right, so you can do whatever you need to do and act as a clinician as you normally would. But the second group of doctors, I'm not going to give you best evidence or ask you what to do. I'm going to give you ChatGPT, right, to answer all your questions. And I'm going to assess your diagnostic reasoning capabilities. So do what you normally do versus ChatGPT. And what they found was the two groups were actually no different. ChatGPT AI did not help compared to normal without ChatGPT. But they did something sneaky. They had a third group that they didn't tell people about. The third group was ChatGPT just by itself, and it outperformed the other two groups. So humans actually made it worse, right? Not better. So the diagnostic reasoning, the AI was better than the clinicians were. Now, of course, this is an artificial environment, limited case scenario, so I don't think anybody needs to panic, but it does make you think about, maybe there's potential here. Keep in mind, this is an older model, and this is a very general large language model. There are much more specialized medical models that do much better than this. So it gives us a little bit of room to think. Of course, the next thing is empathy. Machines can't be empathetic, right? We're empathetic. Will machines ever replace us in terms of empathetic human beings? How many people think it will? Okay. Not yet. How many people think absolutely not? There's nothing that can replace human empathy. Okay. You know I'm setting you up, right? So of course what happens is you see studies like this. It actually says, all right, I'm going to go to an open forum where physicians typically respond to patients in terms of their questions. Now, instead of physicians responding, why don't we get ChatGPT to respond? So they actually compared it. They actually compared physicians to ChatGPT responses. What did they find? They found actually that patients like ChatGPT a lot more. The response of good to very good was 3 to 5 times higher for the ChatGPT responses than the physician responses. But we talked about empathy, right? How many of your patients think you have good bedside manner? Honestly. How many people think they have good bedside manner? How many people know they have terrible bedside manner? Those are all the surgeons. I'm kidding. No, but honestly, we have terrible bedside manner. A lot of us are terrible at it. We may think we're good, but not really. Studies have shown we're not very good in terms of bedside manner. So we're kidding ourselves if we think we're really empathetic. We're not. In this same study, they measured empathy. Patients ranked empathy almost 10 times higher for ChatGPT than physicians, right? Why? Because if you think about it, physicians are busy. Patient asks a question, one-word answer, one sentence maximum, you have to move on to the next thing. ChatGPT has all the time in the world. It will give you long, verbose answers that will make you feel like it cares. That's why the empathy ratings were much higher for ChatGPT. So it makes you think, right? Now, of course, there are other studies out there as well. If you read New England Journal of Medicine AI, there's a randomized trial of generative AI chatbot for mental health treatment. Because we are in a bit of a crisis, there are not many mental health professionals out there in terms of meeting the demand. And we're actually in the study actually said it's about as good as a human therapist, which kind of makes you wonder a little bit, right? So now that I have everyone excited about AI, why is it doing what it does? And why is it comparable to humans in many cases better than humans? And I would argue because medicine's really hard. It's very, very hard. And one of the biggest problems we have in healthcare is cognitive load. Because at the end of the day, if you think about how you function as a clinician, how do you function? You function through data. Everything you do is about data. Everything we do as human beings is about data. And if you think about how we function as human beings, we have 5 senses. Right? Some would say 6, they're usually institutionalized. The 5 are we can see, we can taste, we can touch, we can feel, we can hear. All of those are data inputs. All of that information is going into our brains to process. That's how we perceive the world. So we're, in sense, we're AI, really. That's how we perceive the world, right? How do you function as physicians? When you listen to a heart rate with your stethoscope, is that how you make a diagnosis? Some cases, yes. But in most cases, that's just one piece of what you input into your heads. And people have studied this. They've actually studied it, and what they've been able to show is that the average complex medical decision involves considering hundreds of parameters. Hundreds. A very complex decision, about 1,000 parameters. So let's say your typical complex medical decisions involves about a few hundred parameters. Things from signs and symptoms, vital signs, medical imaging results, social history, labs, sleep patterns, diet, family history, all of that sort of stuff is going in your head. And of course, then you have to listen to all the evidence that's been published, all the randomized trials, observational studies, all of that is being processed in your head. How good are you at it? And people have studied this as well in terms of how much we could process as human beings. There's a famous psychologist in the 1950s named Miller who was able to show us that the average human can process 7 plus or minus 2 things at the same time, right? 7. So of course we're going to struggle. And again, let's be honest with ourselves. What does that mean in terms of impact? The U.S. Office of the Inspector General in the United States did a study on Medicare patients and Medicaid patients. And what they found that people who are hospitalized, 1 in 4 patients experienced harm. 1 in 4. 1 in 8 patients experienced harm so significant that it resulted in a longer length of stay, resulted in permanent harm, required life-saving intervention, or the patient died. 1 in 8. And when they convened a group of experts and said how much of this could be prevented, the experts said over 40%. So we struggle. Why does medicine need AI? If there are 4 core things that clinicians do, diagnosis, prognosis, treatment, and communication, those would be the 4, I think, that most people would say. And again, let's really be honest with ourselves. How good are we at each of these things? We just played a round of Jeopardy, right? With rheumatoid arthritis. How many people got every single question? It's hard. It's really hard. So when we take a look at diagnosis, for example, and again, let's be honest with ourselves, common diagnoses such as asthma, studies have shown this. 1 in Canada, a couple in the United States, some in the UK. 1 out of 3 patients diagnosed with asthma, if you do proper spirometry and lung function tests, actually does not have asthma. Right? Over 50% of patients diagnosed with schizophrenia actually don't have schizophrenia. So we struggle with it. If we take a look at Parkinson's disease, studies have shown that 20 to 30% of patients with Parkinson's disease are initially misdiagnosed. Now, if you give AI an MRI, it'll misdiagnose it in less than 3% of cases. Let's say you get the diagnosis right. How about prognosis? Because consciously or subconsciously, you're making a prognostic decision, right? Is the patient going to do well or are they not going to do very well? That'll determine your treatment strategy. If they're not going to do well, you're going to be very aggressive. If they're going to do okay, you'll be a bit more gentle. But how good are we at prognosis? Study after study after study has shown how poor we are at prognosis. We are not very good at it. We actually did a study at our hospital where we actually went to the floors and our internist actually asked us to do this when we created one of our algorithms. And we asked our doctors, our internists, tell me if this patient's going to die. That's your one job. You don't have any other job. You have to keep the patient alive. Tell me if they're going to die. When we went to the floors, we said, this is not a hypothetical case. It's an actual case that you're seeing. This is your patient. You just finished rounding on them, so you know them. Tell me if they're going to die. When a physician says this patient's going to die, any guess how often they're right? Anyone want to guess? 70%? 29%? No. They're right 29% of the time. Yeah, so because it's hard, right? So are we really good at prognosis? So at our hospital, we have something called RUSH. This is one of the algorithms. I head up an AI program at our hospital. Basically, our vascular surgeons and our cardiovascular surgeons and our nurse practitioners in our units asked us to predict hypoglycemia because many of these patients have diabetes. They'll experience hypoglycemia. It's not great for patients. So we created an algorithm that actually will predict. It will actually tell you which patients are at highest risk. And so then the nurse practitioners especially can go and focus on those patients and do preventive measures. And we've seen a 30% reduction in hypoglycemic events. Got a 3-minute warning, so I'm going to go through this really quickly. In terms of treatment, how good are we at treatment? A lot of it is trial and error. We try one thing. If it works, great. If it doesn't, we try something else. At Princess Margaret Hospital, there's a group of AI scientists who actually have developed a radiation treatment plan algorithm using AI, where clinicians and teams spend hours, if not days, to come up with a good radiation treatment plan. This will do it in about 2 minutes with 88% success and accuracy. Communication. Again, I'd mentioned we need help there as well. There's actually a brilliant orthopedic surgeon at Women's College Hospital who's developed a chatbot called Felix because he's in the OR all the time and he feels really bad. I can't give my patients the time that they need. So he created a chatbot. And the chatbot is available 24/7. It'll answer questions for the patients. And what he noticed was, well, actually, I'm getting fewer calls and my appointments are much more efficient because my patients are much more informed now. And the patients actually rated the AI with 88% favorable responses. Now, I'm going to go through this really, really quickly in the interest of time, unfortunately. Happy to answer questions during the Q&A. But I come from Unity Health Toronto, which is a composition of 3 centers in Toronto. We have a lot of volumes. We store a lot of our data. We have 15 years of historical data, and we have an AI program. I think we're still the only applied AI program in the country that is part of a 3-pillar strategic vision. So what this means is that we have a program, again, where we focus on the end user. We don't work with researchers. We don't work with data scientists. The people that we work with are clinicians. They're administrative decision makers, people who actually understand the problem and deal with it every day. So the busy nurse who just finished a shift in the emergency department or the orthopedic surgeon who just scrubbed out of the OR, those are the people that we work with. We pair them with our AI team, people who actually understand data, people who build models, people who build solutions, and of course, people who do change management and deployment. And it's all centered around a technical environment that enables all of the data and the AI to happen. I think we're the only organization in the country, one of the few in the world, that has actually created this sort of an environment that enables us to do some interesting things. AI scribes. How many people use AI scribes? Okay, the first one in Canada was created at our place. So 2016, a family medicine resident came to us and said, this is absolutely crazy. I'm spending more time on the computer than I am with the patient. Why doesn't the computer just listen to my conversation and generate a note for me? So we created it. So this was developed in 2016. It ended up being a startup. It got acquired last year. But basically, it's been shown to actually reduce workload, saves about 3 to 4 hours per week, and physicians generally have a fairly high satisfaction rate with these. Another example that I'll give, maybe I'll go 2 minutes over, that's okay. I'm going to talk about brain bleed, so intracerebral hemorrhage. This is actually based on a real patient. She came to our hospital about maybe 2 years ago. She had a really bad headache. She went to 2 different community hospitals. They both told her to go home. The second one actually did a head CT, and it was they didn't have radiological services or neurosurgical services. They told her to go home. She started blacking out. She was rushed to our hospital. She was rushed to the operating room. She had 3 infarcts. She survived the procedure, but she was left in a persistent vegetative state. Now, if you come to our hospital in the clinician area, in the emergency department, you're going to see this thing that looks like you're at an airport. It scrolls up it's a big monitor. It scrolls up all the names of our patients. The emergency medicine physician is looking after them. The medical imaging test they ordered, the radiologist is looking after the test. And under status, every now and then, you're going to see this blue thing that says ICH. That stands for intracerebral hemorrhage. That's our AI. Every single head CT that's done goes through our AI, and in just over 1 minute, it will tell you if there's a bleed. It belongs to a parent algorithm called traumatic brain injury, TBI, which will tell you the patient needs to be in the OR right now versus they can wait a few hours versus they don't need surgical intervention. We've compared it to 5 board-certified neurosurgeons and almost 3,000 patients worth of data, and it slightly outperforms them. It misses slightly fewer cases than the 5 board-certified neurosurgeons do. So arguably, this should be at every hospital in the country. Last example I'll give in the interest of time is something called ChartWatch. This is our AI that monitors all of our internal medicine patients. We've expanded it now to general surgery as well as St. Joseph's Hospital, which is a community hospital. Basically, the way this works is it runs every hour on the hour. Every hour, it's ingesting data, typically between 150 to 170 different parameters from labs, vitals, demographics, and it predicts if somebody's going to die. As soon as it reaches a high-risk threshold, it's automated to page the medical team. Our protocols, the medical team has to come and see the patient within 1 hour being paged. And there's all sorts of care pathways. Do you look for signs of sepsis, initiate antibiotics, and so forth? We deployed this over 4 years ago, and we published our paper in the Canadian Medical Association Journal just last year. We've seen a 26% reduction in unexpected mortality, right? So these things are actually helping us save lives. These are not hypothetical. These are actual real cases that are being used currently. And this is what's coming to more hospitals and more clinical practices that's going to shape how you practice. So of course, I'm going to skip over a lot of this. There's a whole extensive framework around how you do this in a responsible way because these things can harm patients. There's a lot of challenges and limitations to these algorithms. We've seen cases of racial discrimination by these algorithms. We've seen cases of suicide. There's a gentleman in Belgium who committed suicide 2 years ago by chatting with a chatbot who told him to kill himself. Another teen committed suicide as well in Florida just last year. And the thing I'll end on is how do you learn more? Because I think as you become more educated, because this stuff is coming, there's now well over 1,000 AI-enabled devices and machines in for purchase, actually, through the FDA approvals. More and more are coming. The plug I'm going to put here is TCARM. It's a center at the University of Toronto that I lead. There's no cost to anybody to join, but it gives you a lot of educational materials. The reality is in Canada, there's a KPMG survey. We rank 44 out of 47 countries in the world in terms of AI literacy. So I would advocate for everyone to learn more about these technologies because these things are coming to a clinic near you. And that's how I think we're going to be able to provide better care for all of us is to embrace these technologies. Thank you.